and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, joined by my co-host, Vivian Hudson. Viv, we got another special guest today, don't we?
Oh, yes, we do. And who would that be, Mike?
So today we have on John, who is going to talk to us a little bit about a test that I think that a lot of people who are listening to this are familiar with it, but have maybe overlooked it because they may have not had such a great experience in years past. But I had been speaking with John about the cancer screens and the tremendous success that they're having with their lab with these cancer screens. So I thought this would be a great time to get him on and maybe get some more interest going in that program. So John, thank you for joining us.
No problem.
John, first and foremost, I know I asked you this question where myself, I'm a little bit confused too. Could you first tell me the difference between a genetic carrier screen and the cancer screens that you're offering?
Sure. So hereditary cancer screening is basically what it looks at is a patient's family history or personal history of having cancer. So basically what the test will offer you is if I'm, so for myself, for instance, if I have a grandmother, an uncle, a sister, all that have been diagnosed with a cancer, whether it's kidney cancer or different types of cancer, we can look at my genetic makeup, look at the mutations within my genetic makeup, and determine whether or not I am at a higher risk than the normal population of developing certain types of cancer. One of the most, the biggest types of cancer that's looked at is breast cancer and ovarian cancer. So that's you might have heard in the past the Angelina Jolie story. That's essentially what the hereditary cancer test is looking at. Whereas the carrier test, what that looks at is when you have mom and dad that are thinking about having children, they want to be tested and take a look at any mutations within their gene pool that could potentially have a child with birth defects or cystic fibrosis or any issues that could arise, Tay-Sachs syndrome, things like that. So very, very different populations, very different tests. And so that would be the major differences between carrier screening and hereditary cancer screening.
Okay.
So when you,
yeah, go ahead.
Sorry, Mike. So when you talk to doctors about this testing, how do you explain that to the doctor to get them to start to recommend the testing to their patients?
Which test are you talking about? Both?
Yeah, well, both. Yeah.
Okay. So with hereditary cancer, I think the main thing that you want to talk about with the physician is, first of all, it's a service, it's a preventative measure, which we all know that CMS, most of your private payers are all going to preventative medicine as opposed to diagnostic medicine. By the time you've used diagnostic medicine, the patient is already well along the path of any disease or problem that they have. Whereas with preventative medicine, we're trying to catch things way before they ever happen. And so as a physician, if you haven't made that transition in a practice to preventative medicine, then you're behind the curve. And so first and foremost, that's kind of the initial message that I would give to a physician. Outside of that, every physician just about that you've gone to deals with cancer on a regular basis. From a podiatrist all the way up to a surgeon, you're going to have some sort of you're going to have patients that come in that have been diagnosed with cancer. Most of those patients have family members that come with them. And so and then finally, if you've had a family member or yourself or a personal history that you've been touched by cancer, we all know how scary it is. And, I think a lot of folks want to know is, well, my mother had breast cancer. I'm a female. Am I at risk or am I okay? And so as a physician, if you can help your patients determine whether or not they are at high risk or they aren't, then that's a huge service that you can do prior to, a conversation that would say, unfortunately, you do have cancer. We have diagnosed you with cancer. So a very different approach than what I would say most physicians are used to. And so it's a service. It's a service that you're providing for your patients that allows you to, to help them have peace of mind. If they're positive, it doesn't mean they have cancer. It just means that they're at a higher risk. So that's kind of the main. Go ahead.
So if you have a patient that is positive, your Angelina Jolie story, what is a physician do with that information?
So that's the thing that is really cool about this test. Most physicians, they tend to shy away from tests that if the results come back and they don't know what to do with them, they don't want to do it. And in this case, it's that scenario, especially for a primary care or an OBGYN or, an internal medicine, whoever's writing the test. So basically what we do as a company, and a lot of companies offer this as well, is that we give them, essentially what we do is refer them to a geneticist or a genetic counselor. And what that genetic counselor will do, we'll actually take the results, interpret them, and let the patient know what that actually means. So does it mean that I'm at a 70% chance now of getting breast cancer, or 40%? What measures can I take in my life to help, prevent it? As Angelina Jolie, she decided to have a double mastectomy because she was positive. And, I think it was one of the bad BRCA genes that actually, that she was positive for. So there's a lot of different things that can happen. But as a physician, they do what they do best, refer it out to a geneticist who then evaluates the data and helps coach the patient through what the next steps are.
So obviously prevention is always better than the cure. So how do insurance companies kind of view this testing as far as reimbursement is concerned? Are they covering the test, or what does that landscape look like?
Yes. What we're finding is that most payers cover the test. It is covered by Medicare. It is covered by a lot of Medicaid plans, a lot of the MCO Medicaid plans, so the managed Medicaid plans. Commercial payers are paying it. Typically, their PPOs are covering it. Of course, commercial payers are all based on, there's many variables that come into play. Whether or not they have unmet deductibles, whether or not they have out-of-network, lab benefits, all of those different factors come into play. But for the most part, it's a covered test.
What does the physician need to establish medical necessity?
So that's another very different part, or very different aspect of hereditary cancer testing. Because we're looking at family history for the most part, and also in certain cases personal history, but for the most part it's family history. The patient has to fill out a family history questionnaire, and in that questionnaire what they basically talk about is who within your family had cancer, what type of cancer did they have, when were they diagnosed, and are they deceased, when were they deceased, things like that. From the personal history standpoint, more than likely what you'll need is progress notes or chart notes showing the actual diagnosis of cancer. So there's two separate types of
so is this is looking at familial history, so you're looking at specific genetic mutations. But what if you have, and I'm going to show my ignorance here, but what if you had a patient that maybe didn't have the familial history, but they have higher risk lifestyle, like they're a heavy smoker or something like that? Would that still constitute medical necessity, or that one thing has nothing to do with the other?
It would not. What you'll find is, especially with all payers, lifestyle cancers, I don't know if that's a proper term, but that's what I use, are typically not, they're not covered. So for instance, certain lung cancers, throat cancer, gum cancer from chewing tobacco, things like that. They're not a covered history or type of cancer, and because they're not attached to gene mutations. And so or at least not yet they are. That doesn't mean that can't happen in the future. So those types of things are not. But if you have a patient that has a family history, typically you're going to find more than one type of cancer within that family.
And this is kind of an off-the-wall question, but this actually did come up before. What if you had somebody that didn't know their family history? What if they're adopted or something, or refugee or something where they had no idea?
Technically, without a known family history, you can't create that medical necessity, and it more than likely would not be a covered benefit. Now, if they have a private insurance, what my recommendation would be is to call the insurance company, explain the scenario, try to get some sort of an authorization to go ahead and run the test. If not, then there is a cash price for the patient that we can run the test for, and I believe it's $899.
Okay.
So
go ahead.
That's still not a bad price for getting a ticket
mind.
on your life,
right,
on the risk in your life. So yeah. No, that's certainly a very valuable test to be offering physicians, and can certainly make a physician look like a hero if they find something before the event happens.
Right.
Yeah.
So I got a last question for you, John, and I'm going to put you on the spot
Sure.
a little bit. When you're seeing a physician, a lot of times you got a very short period of time. So let's say I'm a rep, you're a rep, you're walking into a practice right now, and he says, look, I got 30 seconds, maybe a minute for you. What do you got? What are you offering? What would you be telling that doctor to pique their interest, to get them to want to get some more information and maybe further the conversation?
Well, I think it would go back to what I said earlier. My lead-in would be, hey doc, I wanted to talk to you about some things that your competitors, that a lot of the primary care physicians in the area have added to their bag of tricks, and that is another aspect of preventative medicine, which is hereditary cancer testing. And I would follow that up with, how often do you have a patient that walks through the door that's here for their annual checkup or for blood work, that either they themselves have been touched by cancer or a family member has? And then, of course, they answer the question. And then my follow-up question to that is, what are you currently doing to help them at this moment in your practice? And if they have no answer, then, obviously this is an option for them. It puts them at a competitive advantage. It gives them, another preventative measure that they can offer their patients. And, quite frankly, I think, as a patient, I would want my physician to be able to have access to this. So that's how I would approach it. I think that, you're doing a couple of different things.
Yeah, that's definitely a good pitch. Because most people, I would think more than half the people would answer yes. More than half my patients or have family members that have been affected by cancer. And what are you currently doing with those patients? I'm not doing anything. Well, what if I could show you a tool, a diagnostic tool that would give you some better objective data, so you would know the relative risk for each patient? And I think that's a great lead-in right there. Okay, John, we're running over time. I want to thank you for getting on. So this was great information. Hopefully, if you guys have any questions, feel free to reach out to Viv and I, and we can always forward on your questions. So thank you again for getting on.
Sure, no problem.
Thank you.
Thank you.